at the Sarah Cannon Cancer Center at Menorah Medical Center are prepared to help men face the diagnosis of breast cancer. Our interdisciplinary team of breast radiologists, breast surgeons, breast medical oncology, radiation oncology, pathology, and breast navigation all come together to help guide a man through this potentially stressful diagnosis and try to make the pathway as easy as possible. We are all familiar with the unique challenges that face men with the diagnosis and have gone out of our way to try to make this diagnosis friendly regardless of your gender. We also, in looking to open clinical trials, try to find inclusive clinical trials that accept patients regardless of gender and offer comprehensive genetic counseling services to all of our patients. I am proud to be part of a team that provides services like this here at Menorah Medical Center, and am always available as a resource. Thank you. Good morning, Bret.
Good morning.
How are you?
Graff, how are you?
Good. I'm Dr. Stephanie Graff. I'm a medical oncologist and breast oncologist at Sarah Cannon Cancer Centers in Kansas City. And Bret and I are going to be talking to you guys about how to do a self-breast exam, specifically for men, but I think the things we're going to talk to apply to female patients as well. So if you want to take your shirt off, we'll talk a little bit about self-breast exam and clinician-directed breast exam. So I think the most important thing is when you're doing self-breast exam, if you ever feel anything alarming, you should bring it up with your doctors, right?
Yeah. Always, if you feel something different in your body, to go to your doctor and don't leave until you have an answer that you feel comfortable with.
Yeah, and I think the most important part of self-breast exam is knowing you're normal. So all of our breast tissue naturally feels different, male breast tissue and female breast tissue, and just doing a monthly exam or a monthly check to know what your normal feels like helps you be more aware when something's different.
Exactly.
Yeah. So the first step of any breast exam is just a good external inspection. So obviously Bret has a scar and asymmetry from side to side, but most people's breasts should look about the same on the left and the right side. And so if you notice any skin rashes, any puckering of the nipples, flattening of the nipple areolar complex, or drawing in of the nipple areolar complex, those are still all sorts of unusual things. They should be symmetric in terms of where they are positioned on your body as well. Again, none of us are supermodels. We're not completely perfect. So some of us naturally have one breast larger than the other, but that should be a stable over time. It shouldn't be changing, specifically outside of the situation of breastfeeding, which obviously our men aren't doing for us.
Sure.
And then my habit is to examine people when they're laying back. So I'm going to have you go ahead and lay back. And then I also have patients position one arm up over their head to do the breast exam. And our breasts are sort of shaped like a comma. So we've got a tail of breast tissue that goes down and then the bulk of the breast tissue. So I like to start up in the axilla and using 2 fingers, which are my most sensitive 2 fingers, cover the full area of the breast completely up and down. And some people do it in concentric circles, starting at the nipple and working out like a spiral. And some people go up and down, back and forth, which is my habit. And I think just sticking with what's most comfortable for you is what's most important. For a male breast, most of your breast tissue is concentrated right behind the nipple areolar complex. I think that a lot of people are sort of uncomfortable touching their nipple areolar complex and sort of naturally skip over that when they're doing their breast exam, and that's obviously a really important thing. Is that where you felt your lump?
Yeah, my lump was directly below the right nipple.
Hi, I'm Bret Miller, and I'm a breast cancer survivor. I was 17 when I first found my lump. I was 24 when I was diagnosed. I'm here to tell you today, men, that we get it too.
Begin by looking at your breast in a mirror with your shoulders straight and your arms on your hips. Move your upper body slowly from one side to the other to visualize the entire perimeter of your breast. Here is what you should look for. Breasts that are their usual size, shape, and color. Breasts that have undergone a surgical change should remain stable in appearance. Breasts that are evenly shaped without visual distortion or swelling. Now, raise your arms and look at the same things, gently moving your body from side to side. If you see any of the following changes, bring them to your doctor's attention. Dimpling, puckering, bulging of the skin, a nipple that has changed position or an inverted nipple, such as a pushed inward instead of sticking out, redness, soreness, rash, or swelling. Now flex your arms towards you and look for the same things. gently moving your body from side to side. While you are at the mirror, look for any signs of fluid coming out of one or both nipples. This could be a watery, milky, yellow, or bloody fluid. You should pay attention to any drainage that may show up on underclothing or shirts. Next, feel your breast while lying down, raising your left arm over your head and using your right hand to feel your left breast. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer breast. You can also move your fingers up and down vertically in rows as if you were mowing the lawn, as seen here. This up and down technique seems to work best for most men. Be sure to use the pads of your fingers to feel all the tissues from the front to the back of your breast. Now raise your right arm over your head and use your left hand to feel your right breast. Repeat the steps, remembering to use the pads of your fingers, applying a light pressure to the tissue just below the breast. Use medium pressure for the tissue in the middle of your breast. Use firm pressure for the deep tissue in the back. When you have reached the deep tissue, you should be able to feel down to your rib cage. Finally, feel your breast while you are sitting or standing. You can do this in the shower when your skin is wet and slippery. Cover your entire breast using the same hand movements that you have seen here. Remember, this simple exercise once a month can find a lump or irregularity early. It can save your life.
So be your own advocate. Do your breast self-exams. Get to a doctor if you find something wrong. And remember that men have breasts too.